Hi friends, today I'll talk on post-tuberculosis obstructive airway disease. Obstructive airway disease means the airway is obstructed or the breathing pipe we inhale or exhale, that breathing pipe is obstructed by some pathology. Because of that we have difficulty in inspiration and expiration. There are many causes of obstructive airway disease like smoking and sometimes exposure to some smoke, other type of smoke, industrial smoke or dust. Sometimes there is genetic predisposition also. So there are many causes, but yes, tuberculosis is also a cause. Many patients who are cured or treated with chemotherapy completely, they have completed the treatment, but still they have some problems in the lung, and some of the patients they have obstructive airway disease. Though they have this bacteriological clearance, there is no bacteria in the lung, and the mycobacterium tuberculosis is killed by the treatment, but still the patients suffer from the complication like this obstructive airway impairment. The causes of obstructive airway disease after tuberculosis is treated are extensive fibrosis. These are some pathological changes in the lung like extensive fibrosis, bulla formation, or sometimes bronchiectasis. These pathological changes they cause this obstructive airway disease in this type of patients, and those patients who smoke, in those patients these problems are more and the incidence also more, and this depends on the patient, how many cigarettes the patient had smoked, and age of the patient, and the extent of the initial disease. The more the involvement of the lung in the initial disease, the patient will be having more problem in the airway. The more the age of the patient, the problem of the airway would be more. Likewise, if the patient had smoked a lot and for a long time, then also the patient will be having more problem. That's why for this type of patient, we explain the patient, we counsel the patient so that patient can stop smoking, because his existing problem will increase with smoking. The functional changes in the lungs are hyperinflation, then decrease in patency of airway, decrease or increase elasticity of lung, and sometimes pulmonary gas exchange problems. So these are the functional changes in the lung. And those patients who usually takes chemotherapy or the treatment given by the doctor, they take the treatment properly and regularly, they just don't miss any medicine. In those cases, these type of incidents are low, and patient who don't take proper medication and they just regular medication, they don't take regular medication, and some defaulter patient, they also can get this type of problems, this obstructive airway disease after the treatment is completed. And the patient's breathing problem gradually increases day by day as the age increases, and this is not at all curable. You cannot cure this disease. So the treatment we can give to the patient is, we can reassure the patient, counseling of the patient for smoking cessation. Then some bronchodilators or steroid inhaler can help the patient. That's all we can do. It is just not curable. So friends, that's all for today. Thank you for watching this video and stay healthy.